Welcome to Right at Home's Ask the Expert series. This is an ongoing series that we've been having with a number of our experts here at Right at Home, talking about questions that our clients, prospects, and the public have regarding senior care and the home care services. And today we have Becky and we have Amy here from our nursing department to talk to us about the importance of having nurses involved in home care service, especially within a home care agency, which is not always that common. Most home care agencies are doing primarily just personal care. They may or may not have nursing and nurses involved. So why don't we get to some of the questions that are asked?
Perfect.
And one of them is, what are the benefits of working with a home care agency that has a nursing department versus those that don't?
I would say having a nursing department gives us the ability to have a higher quality assurance mark. We can also teach, as we're training our caregivers, we can train them more disease specific. So if someone has diabetes, as an example, they would be trained to make sure they do check their feet so that there's not sores that could start foot infections, because diabetics cannot feel their feet a lot of times, depending on how advanced the diabetes is. And that's just one example. Maybe somebody with orthostatic hypotension, we can train the caregivers to get them up slowly to make sure that their blood pressure has a chance to respond and their body being upright.
Okay, that's good. Amy, any other thoughts about?
Yes, I think that a home care agency with a nursing department is much more able to coordinate care and certain levels of care with their clients, because say a caregiving client develops a wound or has a sudden cardiac event or a fall, they can always call the office as well as 911, obviously, to ask for advice on what to do and how to handle the situation.
Yeah, I can imagine that some agencies that don't have that nursing input on hand may more of a panic, may just be calling 911,
Right.
bringing in, stressing, trying to figure out what the answer is to something that they see that they're not really aware of.
Right. Absolutely agreed.
So being nurses and working with the caregivers, how does that impact caregiver training? What type of impact do you guys have, and what are you looking at as nurses when you're training caregivers?
I think it goes along with some of those differences with kind of giving more advanced training.
Okay.
So our caregivers can notice symptoms and be proactive with things instead of just reactive. So we can teach them what it looks like if someone is having a stroke, what it looks like if somebody might have an increased heart rate, some different things that can be related to different disease processes. So with training, we can add that extra layer of insight as far as that proactive stance on caregiving.
How about around like assessment development and kind of reviewing and assessment creation? It relates to what you often may see when you don't have a nurse involved with that process versus having a nurse kind of doing that initial assessment.
Oh, the initial.
Right. So I think on the caregiving side, as far as when they go, our client care coordinators go out and do the initial assessment, if they see cares or requests from a client that are outside of the caregiver's scope, they can bring us in, and we may be able to do nurse delegation to provide that care or start nursing services so that we can tag team.
Can you give an example? Has that happened recently, or can you think of a time where she was really glad that they called us when they were doing an assessment that really kind of showed,
So there is a client that we are working with right now that needs caregiving services, but also has a wound, has a catheter that needs to be changed. So, depending on their ability to receive private care, we can then go ahead and treat the wound and change the catheter on a monthly basis as well.
So rather than having to find those resources outside of the organization, it's comprehensive, it's all integrated, and that's probably helps with outcomes and communication and with family and the client and their physicians and all the ones kind of associated with that person.
Absolutely. And that's just part of the continuity of care, keeping that seamless. So we can make phone calls to their doctors, their primary care physicians, if we have questions, kind of get ahead of some of the things that might, that might keep them from staying in their home.
Okay, that's great. Often we'll talk to clients and they'll be saying, well, gee, my caregiver has a CNA or a home care aide, aren't they trained? Don't they then know what to do? I just had a conversation with a client yesterday. It's like, well, wait a second. If they're already trained, what additional training do they need and what type of input from our nursing team can we kind of help impact their level of skill?
Unfortunately, with the training courses to provide certification, really it's just the basics. And there's not usually much hands-on involved as far as actual patients and clients. So they do have the certification, but they don't have the experience. So I think that the nursing team can provide a lot when it comes to getting that experience. We can do role playing with training in the office or in the home to help increase their knowledge base of what the care they're providing.
Anything else you want to add to that?
Probably the little nuances the little tips and tricks for different skills, like with transferring, how to set up the client's body as we transfer to help them keep as much strength as they can, but make them safe at the same time. A lot of times, with the transfer example, they're not taught, how to lean forward, how to use the client's arms for leverage. And so just all of those little nuances and tips and tricks are very helpful to caregivers.
I'm thinking about as it relates having those tips so they don't get hurt or
absolutely
the client doesn't fall.
Absolutely. Yep.
Another point to that is, sometimes when you are training with a medical dummy, they're not an actual person. So they don't move quite the same. They're not going to respond the same. So when they get around an actual client, there can be a little anxiety involved and not knowing what to say in the moment. So you're also teaching on bedside manner and keeping that dignity with the care they're providing.
Yeah, I can see that, especially. I know I've had some clients that caregivers that are manhandling, they're just going through emotions with it. Like a wrestling match with the client rather than having like a bedside manner.
Exactly.
I see that. Last question that I know we get often has to do about this concept of nurse delegation. People are really confused. I had a conversation with a client, with a prospect yesterday about, I think around feeding tubes, crushing meds, and they're like, well, why do you need a nurse to be involved with that? Gee, I mean, I can do that. Why can't a caregiver just do that?
Right. And we have to follow the Washington state regulations. And Washington state regulations say that administering meds, crushing meds, giving through a PEG tube, those all have to be delegated by a nurse. Delegation is basically training. So as that particular skill, we would have either myself or Amy train the caregiver. The caregiver has to become delegated, which is an extra certification process. And that skill is something we are happy to delegate, and then they're able to do that skill. PEG tubes are the same way. We can teach the caregiver how to, like for instance, do a gravity feed in a PEG tube. That keeps them from having to go actually to a skilled nursing facility. They can stay in their home. We just have to follow Washington state guidelines when it comes to certain skills.
I know there's some other skills as well. I know around bowel programs. I think we have a client that has some type of trach.
It's a TEP, and it is kind of like an entrance to a trach, but it helps them to speak. Some care involving that. We have a client who also needs his catheter flushed, his Foley catheter flushed on a daily basis, so that needs delegation. And we also have a client that has a continuous glucose monitor, and that also needs to be delegated. We can help him to apply that.
Okay, well, that's great. Well, that's really some great insight on where a nursing team, a nursing department really can help with care outcomes, and have a really positive experience and help keep people safe at home, which is really what we're all about.
That's
here,
the goal.
right?
Yep.
Okay.
Yeah.
Well, thank you again, Becky and Amy, for joining us in Ask the Expert series. And if you like this video or you like others, then like it below. And we've got a whole bunch of information. You can subscribe. You can download some guides and check out some other videos on our Right at Home website. Thank you.